Good morning. I'm Kapil Sethi. I'm here with Professor Bhim Singhal from Mumbai, India, and I'm interviewing him on behalf of the Archives Committee. Today is June the 18th. We are here in Sydney for the annual Movement Disorders Congress. Dr. Singhal, it's a pleasure. I grew up in India and I finished my neurology training in India, and I've always admired your work. I've always heard about you, and it's such a pleasure sitting down next to you, just asking you a few questions about your life and career.
Thank you, Professor Sethi. I've also known of your work, and I'm quite impressed with what you are doing.
So I would start off by asking you, tell us a little bit about your childhood, your early years, where you grew up, what the conditions were like, and then maybe take it on to the early education.
Thanks, Professor Sethi. I was born in a very small hill station, Mount Abu, in Rajasthan, in India. It had a population of 4,500. And I was educated in the school which was very close to what they call the Adams Memorial Hospital. And during my senior years in the school, I would often go away to the hospital, also offer my volunteer services. That naturally interested me in medicine, and I decided to pursue medicine. My medical education was in Bombay, as it was called then. I joined the Grant Medical College. I did my undergraduate and postgraduate studies in Grant Medical College. After doing my MD, I went to England to do my membership examinations.
About what year was that?
This will
can you
be
put it in perspective?
In 57, 59 actually, to be precise.
Okay.
And I did the resident job in Maida Hospital, which was affiliated to the Institute of Neurology. And I had a great experience over there, learning neurology. Then I returned, and around 61, back to Mumbai to join my alma mater, Grant Medical College.
Okay, so let's just step back a little bit. And in your childhood, was there anybody in particular who influenced your decision about going to medicine, or this was just because you were in close proximity to the hospital?
Well, I think it was more, we used to have the British garrison station in Mount Abu.
Mm-hmm.
And the doctor, the Surgeon General, used to visit the hospital.
Mm-hmm.
And the hospital was extremely well run, and I think that was the major influence. And in those days, one took either engineering or medicine, and my preference naturally with this interaction was towards medicine.
Do you come from a family of doctors, or you were the first physician?
First person.
But I know the tradition's gone on. Your son has now gone on to specialize in neurology as well, which is quite amazing.
Correct.
So during your early medical school, did anybody influence your decision about which particular specialty you wanted to pursue? Is there one person that you can remember, or more than one? And similarly, once you were in medicine, who kind of influenced you to get interested in neuroscience, and why did you get interested in neuroscience?
Well, we just had Dr. Noshir Wadia,
Yes.
who was very well trained in London. He had the opportunity to work under Professor or Lord Russell Brain.
Yes.
And he had just returned. And neurology in the past, in my college, was not very well attended to, and was extremely impressed by his approach to neurology, making a diagnosis in a very logistical fashion, and often he was quite correct, even with the limited facilities. So that indeed was the greatest influence on me.
And how about when you went to UK? Is there one name that you remember that really influenced your career?
Well, we were working, we had to rotate as well, neurosurgery, neurology. And in fact, I worked with Professor Reginald Kelly,
I see.
Professor Sam Nevin,
Uh-huh.
Professor Paul Sendifer, who used to also go to the Great Ormond Street.
Right.
And of course, in those days, we were also attending the Wednesday meetings at the Institute of Neurology at Queen Square.
Yes.
There were many, many masters in those days.
That is true, absolutely. And I remember there were very few neurologists, even back in 81 or so when I finished my training, and things have changed. But when you started, it could be quite different even than what I experienced. So can you tell me what kind of challenges you faced when you were starting your own neurology practice and teaching facility and research facility?
We were extremely, very, very few neurologists then. I could really count them on my fingers.
In the whole big country of India?
In the whole big country of India.
It must be about, at that time, maybe 500 million people. Those
Yes.
years. Yes.
And today we are more than 1 billion.
Right.
And do you know the number of neurologists we have?
No, I don't. Please tell us.
1,500.
Wow. So that ratio is still not optimal. But at that time, you're saying you could count them on your
Yes,
hand.
indeed. We only had Professor Wadia, Professor E.P. Barucha, Dr. Praful Dalal, and Anil Desai. That's all.
Right.
In Mumbai.
Right. So that's a huge metropolis, as we know from watching Slumdog Millionaire. A lot of people are familiar with the city for other reasons too. It's a great metropolis. But so now that there are more neurologists, but at that time, I can imagine the patient load. Did you have a breathing room to even think about research or education or teaching or specializing, subspecializing? I mean, how could one do it? Tell me what kind of challenges did you face at that point, trying to develop a subspecialty interest?
Well, actually, it was difficult, as you know, very, very difficult. We could document the cases and also make a good collection of the cases. It was very difficult even to access the literature. There were no computers.
Right.
Even the telephone system was very primitive. To get in touch with people was extremely difficult. Even going overseas to attend the meetings was difficult. The foreign exchange position was very, very, very bad.
You got $8, I think, when you left, remember?
It's something like that.
Yes, yes. So you really overcame a lot of those challenges and have pursued a wonderful career and taught a lot of neurologists within India and influenced people abroad. But what do you think has been your most significant contribution in the field? And I'm going to come back to movement disorders in a second, but I know your interests are very varied. I know you have changed lives of thousands of people with multiple different disorders, including stroke. But out of everything you've done, and you don't have to say that it's in the field of movement disorders, just what do you think is your most significant contribution in the field of neurology and then movement disorders?
Well, one, of course, I enjoyed caring for the patients. I enjoyed also teaching. I also, collected the cases and wrote our own, what we saw. It was difficult to get published in all the international journals at times. But the things that interested me were also demyelinating disorders. And I did contribute to the clinical pattern of this, at that time considered to be extremely rare or possibly unknown disease.
In India?
In India.
Uh-huh.
But I think we did some autopsy studies as well and wrote up some confirmed cases. And there were no pediatric neurologists. So in fact, I had to do a little bit of pediatric neurology as well.
Amazing.
And I had the fortune of working under Paul Sendifer, who was a great pediatric neurologist.
Sandifer syndrome.
Yes,
oh,
indeed.
That's indeed a famous name.
So we used to go along, and I got interested in collecting patients with leukodystrophies. And what interesting thing that I found was that they were all with large head. In fact, in the early days, I remember one patient had, because there were no CT scans, and they tried to do the S study, they failed, but they tried to even do a shunt procedure.
Oh, yes.
But later on, we realized that these large heads and little bit of an imbalance of the gait were leukodystrophies.
So Alexander's is kind of a prototypical one
Sometimes
where you
similar,
have large head, but other leukodystrophies you found also
It was
have
different.
the same pattern.
It was different. We collected cases. We also presented in Japan, and these were megaencephalic leukodystrophy with cysts in the temporal
I
regions.
remember that one, yes.
Wanda Knapp of Holland, Netherlands, she wrote up an extremely good paper. And we also found that this was seen in a particular community, the Agarwal community. It was difficult to get the genetic study done in India, but thanks to Sakubai Naidu of the Kennedy Krieger Institute in Johns Hopkins,
yes.
helped me out. And we found the gene defect with a founder effect. So I think that might be considered as, well, I don't know whether it really is a contribution, but
It is, absolutely. It's one of the many, but I would say that looking back, you think that might have been your most original contribution. Now, you were pioneers in neurology, names you have mentioned earlier in India, and things have changed considerably. What advice would you give to the young viewers, your young physician scientists that are coming up in India? What kind of insight, what advice can you give them as to how to pursue their careers now, given that the challenges remain? Again, the patient load is really huge. I walked through some clinics in India, and a lot of them don't have appointments, they just come. And how do you achieve a balance where you can do research as well as take care of large numbers of patients?
My advice to the young neurologists would be to document the cases very thoroughly, attend the international meetings. They of course have today, as you know, an information overload. Some of the residents, of course, as you are doing the round, can get onto their Google, get the information,
Dr.
present
Google,
their
yes.
article.
They consult Dr. Google right away.
Right
No
away.
insight, but lots of knowledge.
In fact, they are my teachers,
No wisdom, but a lot of knowledge.
Yes. And in fact, I would say that identify your interests, and as you know, movement disorder specialty is becoming a very, very attractive specialty, and people are taking it up. So I would say that documentation of cases, developing clinical interest, having colleagues, if they do not have the facilities to have a collaborative programs, identify these situations of the problem they particularly face,
Right.
and also contribute, besides care of the patients, to the literature to a certain extent, and keep themselves updated with the knowledge.
Right. And I know I'm kind of rewinding, but you started treating movement disorders before the word movement disorders existed. And you must remember vividly when the society was formed. Can you tell us a little bit about when did you become aware of the society, and how have you participated in the affairs of the Movement Disorder Society itself?
Tell you a bit about this interest. When I came back in the 60s to India, we would see these patients, and we were pretty helpless. All we could prescribe for a patient with Parkinson's disease was trihexyphenidyl. And then we heard about the stereotaxic surgery by Irving Cooper.
Right.
My neurosurgical colleague, Dr. Bhagwati, was trained in London at the Atkinson Morley. Very dynamic neurosurgeon, very innovative. When he joined us, he got the frame made and started the stereotaxic surgery. I helped him when assessing the patients before, helped him during the surgery, and post-operatively. And in fact, we were doing the chemopallidotomy or thalamotomy. And about the same time, actually, when I was in my Maidavale hospital, Professor Lauri Laitinen of Finland was also there. At that time interested more in aneurysms, but later on got involved with stereotaxic surgery.
Following Glaxell's footsteps.
And then he came to India as well.
Huh.
And at the same time, Professor Narabayashi, another big name in the field of stereotactic surgery from Japan, also visited us. And I think all these really made me quite interested in the movement disorders in general. And of course, when the levodopa came on the scene, we discontinued, and there are younger colleagues now doing the DBS.
Right.
So this was my initiation, and the second thing which happened was that I was invited to join the WHO working group on Parkinson's disease.
Right.
As an Indian representative. And they know, as you know, they were dealing with the health problems or public aspects problems of the Parkinson's disease. I attended the meetings. First meeting that I attended was in Barcelona. Subsequently, I've attended nearly all the meetings. And Professor Yoshi was also a member of the working group, and he invited me to Tokyo for the APPDA meeting.
Right.
And that I have been attending subsequently. So that after the meeting in Tokyo of the working group, when I got back to India, I thought I should form a similar society. So I created the Parkinson's Disease and Movement Disorder Society with my help, my colleagues, in the year 2001. And I was...
You were so far ahead of your time.
Well,
We are now changing the name of Movement Disorder Society to International Parkinson and Movement Disorder Society. And you had already named it. I saw it on the web when I was searching this, when we were thinking about changing the name, and there was one person in the world who had that name already, somewhat different. So you probably started it like in the 80s.
No, this was in 2001.
Oh, it's later, 2001. But the Movement Disorder Society was formed in the mid-80s. How did you get involved with the Movement Disorder
Before
Society?
this, let me also tell you, in 2003, I organized the International Symposium. We invited 40 persons from all over the world, including yourself,
Yes, right. Thank
Professor
you.
Tony Lang, and several others. You know, the names that I had heard about, and they're very, very kind, really, to accept the invitation. And we had 2 meetings simultaneously. Nearly 400 neurologists from India participated on a 2.5-day meeting. And at the same time, we had a separate session for the Parkinson's disease patients. And nearly 150 people gathered.
Right. I remember that very well. Yes.
And Mrs. Mary Baker, who was the chairperson of the working group on Parkinson's disease, launched for the first time the Global Declaration on Parkinson's disease.
Right.
And that declaration was signed by the visiting faculty. Not only that, also by the industrialists and the celebrities.
Yes.
So I think that really gave me some satisfaction, but also a great boost to the Parkinson's disease. So that I think
In
I
India,
have enjoyed.
especially, yes. So again, let's go beyond India a little bit. You know that the Asia Oceanic section of the Movement Disorder Society has become very, very important for the society because of large populations that are underserved. We talked about India, but there are many other Southeast Asian countries, Asian countries. How did you get involved with the Asia Oceanic section? And I know at one time you were the president. Could you tell us a little bit about the development of the section and how has that influenced teaching and care in this area?
I joined the Movement Disorder Society in the year 2000. And I started attending the meetings and I learned a good deal. And I also had good colleagues and friends. In the year 2007, I was asked whether I would accept to be the chairperson elect. And in 2009 to 11, I was the chairperson. It was a great experience with all the teleconferences with the section colleagues of mine and also with the MDS leadership. And so many programs, thanks to MDS, were initiated. We had the ambassador program, the course program. We also had the fellowship program being initiated. And I think these meetings, which one of the meetings was held in Singapore, and another meeting was held in Delhi, and another meeting was held in Taipei. And the meetings at Delhi, Professor Madhuri Bihari,
Remember that one?
and at Taipei by Professor Robin Wu,
Yes.
were very well attended and were a great hit. So I think the Movement Disorder Society has played a very, very important role in promoting the care of the patients and involvement of the neurologists in areas where so far the societies and the care did not exist. And I think many of these educational courses, ambassador programs are held in different areas in India and other regions of Asia.
Right. So the internet has made things somewhat easier. You said initially that it was very difficult to get information, and even the underdeveloped countries have access to internet by and large, maybe limited. You know that Movement Disorder Society website recently won an award for being one of the best websites. What should we do to improve the knowledge of Asia-Oceanic section people about the existence of the website? How can we direct them to that, and what would be your advice how to reach more people in this section?
But this is happening actually, let me tell you. And I think the people are also becoming, for the Asian region, the Movement Disorder Society has been very kind, so that there's a reduced membership fee. Also, there are, in most of the National Society meetings, there are sections of the Movement Disorder Society. And I think it's not affiliated to the Movement Disorder Society, but the Movement Disorder section. But I would think that if the Movement Disorder Society, perhaps interlinked with Asian and Oceanic Society, and also with the national societies, say in our regions, and play some role, and we have some people coming in to teach and participate as the faculty, I think that will help considerably. Already I know that some organizations conduct summer classes and some courses in India, and I think overall I'm very, very happy that things are moving in the very right direction.
Good. You have really achieved a lot. We talked about your early career and subsequent development. One other thing that you've done, you talked about a little bit about patient education, and I've been always impressed with your initiatives regarding patients with Parkinson's disease in India. Can you tell us a little bit more about what you're trying to develop, what you already developed for the patient, other than that one meeting we talked about?
Well, actually, we now have, thanks to the people who are helping me, we now have 10 support chapters in the city of Mumbai. And we have one each in Nasik and Goa. Our next project will be in Bhavnagar in Gujarat. My goal is, or dream is, to have similar support groups throughout India. Let me tell you one thing, that drugs are very important. There's a lot available in the scientific field for these patients, but what these patients enjoy most is to attend these support group meetings. We have introduced in these yoga, we have also introduced dance as a form of therapy. We have also introduced physiotherapy, speech therapy, and there are sessions being held throughout the week everywhere. We've also created a helpline so that they can get. We have a web page so that they can get us, so that the answers can be given and help can be provided. We also have a reach out program, and in that program our physiotherapists and speech therapists go out to the homes of the patients that are not able to come, and not only that, we also support them by giving them free medication. So in fact, I think that has been a very, very satisfying thing for me.
So you have boundless energy. Considering what all you do, all different areas of neurology, education, how do you achieve a work-life balance? I mean, what other interests do you have, or do you have any time to develop other interests?
Well, frankly, I think I had to, considering the needs of the country,
right,
and considering the demands on our time. And as you know, in India, the cultural issues are such that we have to be available all the time. Mm-hmm. We cannot have privacy of switching off the cell's telephone system. So we are approached at all times as well. But all said and done, in my life, my wife is a gynecologist. My son, as you mentioned,
yes,
is associate professor, Mass General Hospital in Boston. And my daughter also took up medicine and is doing myeloma at the Northwest University in Chicago. So in fact, as they took up medicine, they understood that I have to work. All the same, we took time off. We enjoyed travels together. Most of these travels were sometimes entirely holiday, but quite often coupled with the international meetings.
yes,
And took time off.
So travel is one of your interests.
Yes, and during the travel I got time to catch up of my light reading,
okay,
autobiographies or even fiction.
So you like reading a lot of fiction,
Yes,
and non-fiction. You've been hugely successful. Maybe you can't change how your career developed, but if you go back 20 years, let's rewind 20 years, maybe 30 in your case, what would you do different? Let's say you have a chance to do it all over again.
Well, frankly, I think I'm quite satisfied with what has happened. And one of the main reasons is that I was trying to do and attend to the unmet needs of the country. Clinical neurology was extremely important in those days, and I continued to do that. And I think looking back, perhaps I would still be doing the same. The only additional thing that I would have liked to have done, had the facilities been available, perhaps spend some time in learning techniques of research and even animal work, which I never did, even to understand the intricacies of how these things are done, let alone doing it myself. Or perhaps teach the younger people some aspects of how these things should be done.
Right.
That aspect, I think, I have missed to some extent.
Well, it's actually perfectly understandable. It must be very gratifying to say that there's not a lot you could have changed or would have changed. And clearly, even now that problem exists even in U.S. For example, NIH just started courses trying to teach young physicians research methods and statistics and stuff like that, which is not part of a usual curriculum. So I really wouldn't beat myself up over that. Obviously, ideally, one has to do everything, but it's impossible given the time constraints you have had, and I certainly understand and congratulate you on developing neurology and movement disorders in India. But having said that, did you experience any, we talked about barriers in sense of large patient load, lack of access to literature and all that, but biases, did you experience any biases, especially when you went abroad? And you were, again, very early in terms of immigration from India. So did you experience any bias?
Well, frankly, I was very fortunate. Very good friends. I didn't experience bias in that direction. In fact, I have made some excellent friends as well. And as you know, Professor Gerald Stern, who is also very much in the movement disorder, was senior to me, but also a good friend, guided me. And I think overall, from that angle, I did not experience any bias, and I think quite helped. And whenever I approached anybody, it was helpful. The only difficulty, as I mentioned, was the access to the literature, or getting, suppose I got interested in something, how to proceed further, was the difficulty that I experienced.
Right.
And fortunately, I think today's generation does not face that sort of an issue. They probably have to face with the information overload, and they got to restrict to their fields of interest.
So they don't have the same barriers as you experience, but you think there are any biases, let's say, against women neurologists in India? How are the women doing in these somewhat developing or underdeveloped countries that are coming up?
In my own country, there is no barrier. In fact, Professor Madhuri Bihari is professor. Professor Devika Nag in Lucknow is professor. And I think even in the field of epilepsy and others, the ladies are taking up in a big way.
Okay.
So I think from that angle, there is no gender bias.
Okay.
And people are interested in taking it up. From the surgical aspects, maybe the patients may have some bias against the women surgeons.
That still exists.
Yeah, that is
So where do you see neurology and movement disorders in India, say 10 years from now, 20 years from now?
Well, I think it will move forward quite well. We now have, fortunately, neurologists who are restricting to the field of movement disorders. We have Dr. Mohit Bhatt. We have Dr. Petros Wadia. Mohit Bhatt was trained in Canada, Vancouver,
Right.
Donald Kahn. We have Dr. Petros Wadia, who has come back with good experience with Professor Tony Lang.
Right.
And we are fortunate that some of the Indian neurologists are taken up for the fellowship programs in well-established centers. And there will also be an exchange program within the Asian countries.
Good. So I think that concludes our interview, and I'd like to thank you for taking the time.
Thank you, Dr. Sethi.
Thank
very
you, sir.
kind of you.
Thank you very much.
Thank you.